Good morning, Radio Seku, Sarasota, Florida. Today, our guest is Dr. NIKKI Kitty in Singapore. Dr. NIKKI Kitty is a Zimbabwean physician practicing in Singapore. She has a decade of experience working in public sector hospitals and public health agencies in Singapore. She is currently specializing in preventive medicine with a special interest in epidemiology, health policy, and regulatory science for vaccine and pharmaceutical. She's currently working on the front line of the COVID-19 outbreak in Singapore as a volunteer in the accident and emergency department of a large public hospital. Prior to her career in medicine, she worked as a research assistant in an HIV vaccine trial in East Africa. She has a special interest in global health policy and health system research. Dr. NIKKI graduated with BA in liberal arts, anthropology, and chemistry major from McAllister College in St. Paul, Minnesota. She holds an MD in medicine from Duke NUS Medical School in Singapore, as well as an MSc in Global Health Science, Epidemiology from the University of Oxford in England. Dr. NIKKI, good morning. I don't know if it's a good evening or good morning in Singapore.
Hi, Seku. It's evening here in Singapore. It's 11 p.m.
Well, I just read you a tremendous bio to the Seku Radio listener. Is anything else you want to add to that? Can you introduce yourself to the public, please?
I think you pretty much covered everything. I was raised and grew up in Zimbabwe, but I've lived around the world doing what I love, which is public health and global health and how politics and science and medicine intersect. That's what I've been working on my whole life.
So you say you've been doing this for 10 years now?
I've been working professionally in medicine for 10 years. But before that, I worked, as we mentioned, in vaccine trials as a social scientist. And I studied global health and epidemiology with research in Kenya.
Okay. Now, let's go back and do a little of a history on your early years. I'm assuming one of your parents is a doctor. How did you develop interest for medicine this early, at your early age?
I didn't actually want to be a doctor when I was younger. So my goal was to get a degree in anthropology in college, which I did. And I was really interested in that aspect of social science, of studying the human condition. And through my work in medical anthropology, I met a lot of physicians and doctors whom I really admired. And that's when I started thinking after college that this is a career that, is a really human career, but also scientific. It really brought together the things I was interested in. I did chemistry as well in school, as well as anthropology. And I couldn't think of any other career where anthropology and chemistry would be useful, both of those combinations. But it wasn't something I thought about when I was a child.
Right. Now, from reading your resume, you did spend some time in U.S., 4 years, I believe, in McAllister College. Can you talk about that? experience a little bit.
Yes, I went to college at a small private liberal arts college called McAllister. And I don't know, it's not a very well-known school if you're not in that, if you're not in the Midwest. But it's a very international focused school. It's a school that prides itself on producing global citizens who are aware of what's happening around the world, who are socially conscious, and who work towards social justice. So I was really lucky to go to school at a place like that encouraged internationalism, that encouraged service, that encouraged global connectivity and a shared world. So some of my closest friends are still people I met in college from all over the world. We had students from Africa, from Asia, from the Middle East, Latin America, everywhere. It was really the United Nations on a college campus. And one of our most famous alumni from that school is Dr. Kofi Annan, who we know was the Secretary General of the United Nations.
Former Secretary for UN, yes. From Ghana, you're right, Kofi Annan.
Yes. He went to college in St. Paul as well.
Do McAllister have a grad school?
No, it's an undergraduate liberal arts school, so there's no graduate school.
They don't have graduate school. So as a result of that, you landed in Singapore. Now let's talk about your experience with Singapore. I believe it's University of Singapore Medical School or NUS. What does that stand for?
So the school I went to is actually a school that was co-developed by the National University of Singapore, NUS, as well as Duke University from the United States. So the school is using the Duke curriculum, but the campus is an Asian-focused campus, but using a Duke-style teaching. So Duke has a very unique medical school program where you spend your third year of medical school entirely dedicated to research. So this is very unique in America. You don't have a lot of MD programs where you take a year out just purely for research. So I think the Singaporean government found that element interesting to create physicians who have a research drive, who know how to do research. So they promoted it, and we had that curriculum in Singapore.
Mm-hmm. Okay, today we have our guest is Dr. NIKKI Kitty, who is a public health person in Singapore. The subject of our meeting today is COVID-19, Corona. Some people call it Corona. There's a lot of different names to this virus, Doctor. What would be the proper way to call it? Which one is more official to name it? COVID-19 is the appropriate one?
So there's two official names, actually, for this illness. So one is the disease itself, which WHO has named COVID-19. It's a short form of coronavirus disease 2019. So for short, we just call it COVID-19. This was the name that the WHO gave it. But at the same time that WHO was naming the disease that causes the illness, scientists who study viruses, these are virologists, also have their own way of classifying viruses and naming them. And the virologists settled on the name SARS-CoV-2 for the name of the virus which causes the illness that we call COVID-19. So you'll hear these two names. They're both official. Yeah.
Both official. But Corona, as I understand, there's different viruses named Corona, right?
Yes. Coronaviruses are a family of viruses. And we have several viruses that are endemic to humans, so it means they've been causing infection in humans for very long. Then you have some newer ones like SARS and MERS, and then of course you have this very new virus that only came out in 2019 that's having the current pandemic.
Now, my question to you, many people have mentioned that before, these viruses are coming from bats. Is the bat have a special immune system for these highly diseases? I mean, these viruses, diseases?
Yes, so many of the diseases, or what we call emerging infectious diseases, do originate from animals originally. Just because the virus finds a suitable host that is able to replicate. And we're not quite sure how this new virus may have come to human beings. It could be through a bat host or other intermediate species in between a bat and a human. Because even among animals, they can exchange genes and exchange viruses. So we're not exactly sure where exactly the jump from animals to humans occurred. But yes, bats are a common reservoir for many diseases such as Nipah virus, Ebola, and other diseases.
So some viruses are named after the original part of the origin. Ebola, for example, is down in RDC's Congo. Why the World Health Department use those names of those villages or places disease originated?
So I think in the past, it was just an easy way to name the virus from where it was discovered or the scientists who discovered it. But in recent years, I think we found that naming a virus after a place or a person can introduce some stigma to that community. So Ebola is a river in the Democratic Republic of Congo. And we have many diseases that are named, like Nipah is a village in Malaysia. So a lot of these viruses become associated with those towns, which is really unfair for your town to be associated with one of the bad things that happened to it. If anything, we'd want your town to be celebrated for something good that happened. So WHO really discourages the naming of viruses in this way, which is why they chose a very neutral name this time. Even for SARS, WHO named SARS, and they gave it a very neutral name that didn't reference a place or any geography.
Now, one question I have also is, today I was listening to the news that in New York, a zookeeper have transmitted COVID-19 to a tiger, several tigers in New York Zoo. Is the transmission to human can jump to animal, and can animal jump to human? Is that a possibility here?
Yes, it is a possibility. As long as the animal in question has the receptor that the virus needs to enter a cell, then that animal would possibly be vulnerable to an infection. So I'm not a tiger biology specialist, but if they can be infected by this virus, then they contain a certain receptor, what we call the ACE receptor, that humans also have in their respiratory cells. It means that tigers also have this. So any animal that would have this same receptor could potentially be infected by this SARS-CoV-2. SARS-CoV-2, sorry.
Right. So the originations of this virus, just tell us, how can we, the world in general, basically prevent this? Because there's no vaccine as we speak, right?
Yes. So I think to prevent the spread between humans to humans, we just use the basic principles of public health, which is number one, keep your distance from people who are sick. Keep your distance from each other, because you can't be sure if you're sick. As we know, this virus can be shedding from people who don't have any symptoms. So they don't feel sick at all, but they're able to spread this virus. So maintaining the social distance that I think the governments around the world have been, asking or mandating people to keep away from each other, socially distance as much as possible. This is the number one way we can prevent transmission. If you do have to go out, there are two other things you can do. One is to wash your hands after you touch any surface. Try not to shake hands, prevent hand-to-hand transmission.